Hello, my name's Sue Ashmore and I'm the Programme Director of UNICEF UK's Baby Friendly initiative. I'm going to talk to you today about a call to action that UNICEF UK has made to all 4 governments of the UK. First of all, I'm going to give you a little bit of background as to why we decided to do this, then talk you through what the call to action is all about, and then at the end ask you if you will join us in our campaign to improve women's experience of breastfeeding in the UK. I'm going to start with a little bit of history. As many of you will know, the Baby Friendly initiative has been running in the UK for around 20 years. Our role is to support best practice for infant feeding and relationship building within healthcare settings. We work in maternity services, health visiting services, neonatal and children's centres, and we also have a programme for universities. Our work is designed to help you do the work that you would already be doing, only do it more effectively so that we get the best outcomes that we can for mothers and babies. The programme, as I say, has been running for 20 years and has been very successful. And as I speak, we have 90% of maternity services and 82% of health visiting services engaged with the programme, which means that they've had at least one award from us, either a stage 1, stage 2 or full accreditation. And over half of the services are fully accredited as baby friendly. In the spring of this year, there was an important new piece of evidence published. It was a review of the state of breastfeeding the world over, and it was published in The Lancet and had received funding from the Gates Foundation to help create this really important work. And what these papers said in The Lancet was that, as we all know, breastfeeding has many health benefits for babies and their mothers in all countries of the world. And in fact, the Lancet report said that 820,000 babies' lives would be saved a year if more babies were breastfed. But these papers were quite interesting because they also said many other things. And one of the things they said was that baby friendly should be implemented across health services the world over because it's been shown to be effective. So that's great for the UK because all of us health professionals have been busy doing that for many a long year. But it also pointed out that much more needed to be done than just the health professionals doing their job in the best way that they could. And it also pointed out and named the UK specifically as having some of the lowest breastfeeding continuation rates in the world. We at UNICEF sat down and thought very hard about, well, why? Why is that the case? You cannot possibly lay the blame at health professionals' doors. They've done everything that they possibly can to implement the baby-friendly standards, and many, many places have gone way beyond the baby-friendly standards. Thousands of staff have been trained and practices have improved quite significantly. Yet we still have these really low breastfeeding rates. What can we do? Why is that, and what can we do as a nation to improve that situation? One of the reasons that the UK has such low breastfeeding rates is because of our culture. And I probably don't need to say this to the health visitors in this room. The UK has one of the most entrenched bottle feeding cultures in the world. We started bottle feeding before almost any other nation. Just after the Second World War, we went to mass bottle feeding, so we've now had generations of babies that have been bottle fed. We tend to have an attitude within our culture as a cultural norm that I was bottle fed and I'm fine. There's not really that much difference between the two. And despite all the evidence that's come out over the past 30 years, that's still our cultural norm in this country. Because of that, we have real issues around how we support individual mothers to breastfeed we tend to see breastfeeding and infant feeding as a whole as something that is merely a matter of individual choice. We find it a very difficult subject to talk about. It's a very controversial subject and a very contentious subject in this country. We generally have real difficulties not bringing in our own personal experience, and most people do that, be that a government health minister or be that a health professionals working in the community or on the wards, or the mothers and the families that we care for. So what happens is, whenever there is any new evidence about breastfeeding or whenever the topic is raised, it can get very heated very quickly. An example is that when the Lancet study was published in the spring, there was quite a bit of publicity, quite a bit of coverage in the media, and it was very interesting to see how this very important, very well conducted research was covered in the media as, do we make women feel guilty about breastfeeding? Do we put too much pressure on women to breastfeed? And the actual content of the paper was largely ignored. This means that within this country we have many hundreds of thousands of families who can feel very hurt by this issue. So if you or I or my sister or your sister or our friends or our family or our work colleagues have not breastfed their babies or have tried really hard to breastfeed their babies, as so many people have, and have not managed to do so, if you bring up a conversation about how we can increase breastfeeding rates, there tends to be a feeling of hurt and guilt, and people then react to that. So we close down conversations, and rather than move on with this topic and treat it as the big public health issue that we need to treat it as, we have a habit of treating it as though it's something very personal and entirely the responsibility of individual mothers to get right. On top of that, and within that culture, we have a leadership issue with breastfeeding in this country. At the moment, particularly in England, there is very little coordination. We do not have any leadership for breastfeeding at government level, and we don't have any sort of strategy in England to support infant feeding going forward. That's very different in some of the other countries of the UK who have a much better coordination and do have strategies. There are also, given the size of the problem, given the fact that we have some of the lowest breastfeeding rates in the world, there are insufficient resources to tackle the problem. And also those resources are getting less and less rather than more and more. And therefore our continuation rates remain low. And I think it is all credit to the health professionals who have done so much, and the voluntary sector workers and the other charities apart from UNICEF who work in this field. It is all credit to us that the breastfeeding rates have not gone down over the past 5 years. So, what is the call to action? What we decided, we did our analysis looking at, well, why do we have such a problem? And then we made a decision that we wanted to create a document that was aimed at the UK governments, the governments in the 4 nations of the UK, but that wasn't just a blame or a complaint, but was more an explanation as to why we're in this situation in the UK and why it's such a contentious and such an emotive issue. But we also wanted to provide a roadmap, a guideline for what we thought was needed. Now, we didn't just sit in a room and do this ourselves. We went out there and we asked the other organisations and we asked the academics and experts in this field what they thought we needed to do, what they thought was the best way forward. And then we wrote that down as a guide for government, as a possible way forward. And we also wanted to start a campaign. Now, we didn't want to start a campaign that was a major public-facing campaign because, as I've said previously, in the UK we are probably not ready for that. And it could very easily have backfired because of how much emotion and contention there is and hurt that there is around this issue. But it was more a campaign aimed at our supporters, aimed at health professionals, other organisations and supporters, so that we could all sign up to something and agree that this is what we all thought was the way forward. The call to action has 4 asks. The first ask is that each government creates a national infant feeding strategy board. We've chosen those words quite carefully. We don't want a breastfeeding committee like we've had many times before, where people just sit round and chat. What we would really like is for a high-level, cross-departmental, government-led board that looks at the strategy that is needed to drive this issue forward. We would also like breastfeeding to be in relevant policy areas. At the moment, sometimes it's very well represented in relevant policy areas, and that's great. But other times, it's missed out altogether. The recent obesity strategy is a good example of that. It seems incredible that a childhood obesity strategy would not mention infant feeding, but this one didn't. And that omission leaves a great big gap that affects the health and well-being of our children. So we want the board to keep an eye on relevant policy areas, not just in health, but also in community areas, in education, so that when it's relevant and in the right way, breastfeeding gets a mention. We would also like there to be a real commitment to implement the evidence-based initiatives that there are out there, not just the baby-friendly initiatives, but other initiatives that will support families to breastfeed, but will also start to tackle this entrenched culture that we have in the UK. And the 4th ask is that governments adopt in full the International Code of Marketing of Breast Milk Substitutes, so that the absolute extreme advertising that we seem to get in the UK, including on the television, including on magazines, including on websites, that contain so much misinformation and that reinforces again and again our bottle feeding culture, can be curbed through legislation that is then properly monitored and enforced, so that only fully non-commercially based, proper evidence-based information is given to parents and to health professionals. And there's plenty of that out there via charities such as First Steps Nutrition, via the Department of Health and via UNICEF. So we are not wanting parents to be denied information or health professionals to be denied information, but we only want that information to be evidence-based, scientific and factual, and free from commercial influence. So how have we been getting on? Well, we launched the call to action in the summer, and so far we've had 4,000 health professionals and supporters sign up to the call to action, and we asked a range of organisations, around 30 organisations who had a real interest in this issue, if they would also sign to say they supported the call to action, and all of them did, so that's excellent. We're also trying, in all the work that we're doing, but also influencing other organisations and individuals to do the same, to change the way we talk about breastfeeding. So to shift away from conversations that imply that this major public health issue is the responsibility of individual mums sitting in their front rooms struggling with their breastfeeding, and that somehow they're the ones that are responsible for taking this forward, and saying, no, that's not fair. This is everyone's responsibility. This is the government's responsibility, it's the NGO's responsibility, it's community's responsibility, health professionals, but also individuals, shopkeepers, family, friends, etc. We all need to recognise that this is important, and we all need to recognise that families need a lot of support and encouragement and enablement to take this forward. So the way that we are starting to write about this issue in UNICEF and encouraging our partner organisations to do the same is to take a kind and a soft approach, but also to say, hang on a minute, there is a responsibility here, and the responsibility lies with all of us. We want to develop the call to action further. Our plan is that we are going to develop individual guidance and roadmaps for each of the 4 steps of the call to action, which will go with the main document, and we're going to launch those at our conference in November. And we're also producing a video that explains the need to change the conversation and explains the need for a call to action, and that again will be launched later this year. In the summer, the UN Committee on the Rights of the Child reported on the UK and on the UK's adherence to the UNCRC. It made some very specific comments about breastfeeding rates in the UK and called on the UK to basically do the same thing that the call to action is calling for. So it's not just UNICEF UK that are saying this. Also, the United Nations is telling the UK that they need to do more to promote, protect and support breastfeeding, and that they need to be implementing the code. As a last word that may be very interesting to health visitors, also during the summer, Public Health England and UNICEF UK produce commissioning guidelines for local authorities. If I do say so myself, they are pretty good, these guidelines. There's a fabulous set of infographics that anybody is very welcome to use as they wish, to copy, to use in their own training, to take to their commissioners, and a comprehensive guidance document as to what is actually needed on a local level to start looking at these issues and improving breastfeeding rates. The document has forwards by the Chief Medical Officer and the Chief Nurse and the National Director for PHE, and it's there for you to use. You can access it via the Baby Friendly website. There's a link on our first page. Please do take it, please use it in any way that you see fit to take forward this issue in your own local area. Lastly, I would like to ask if it's possible for some of you people listening to this talk, if you could go onto our website, and if you agree with what we're saying, that we need to change the conversation, we need to be doing more, and we need to be asking the government to take a role in helping us with this. You could add your voice to the campaign by going onto our website, signing up, saying yes you agree, and then keeping an eye on what happens next so that we can all build on this together and help build a society that really does protect and nurture breastfeeding and so the health and well-being of our babies and their mothers and their families. Thank you very much.